Thank
I'd
you,
like
Kyle.
slice it in half and eat the most frosting.
Yeah, it's just frosting.
Aren't you sweet fans?
I would rather have a donut than
Okay,
like.
good evening. We're going to call the meeting to order for the McHenry County Board of Health, January 22nd, 2024 meeting. And we're calling to order at 6:34 p.m. I'm going to ask that we start the meeting with a voice roll call for the benefit of those that are watching on video or listening via audio.
Ms. Ortiz?
Here.
Ms. Carmen?
Here.
Dr. McGuire?
Here.
Ms. Altop?
Here.
Ms. Gaffney?
Yes,
Ms. Clark? Here. Mr. Marcuson?
Yes.
Ms. Morowski?
Here.
Dr. Katz?
Here.
Mr. Clark?
Here. We do have a quorum present, and the meeting will be official. Any public comments this evening? Hearing, seeing none, we will move to item number 3 on the agenda, which is employee recognition. Tonight, we are recognizing Liliana Dominguez, an employee of the nursing division, and I'll turn it over to Susan Karras for comments.
Here. Liliana started with us as an administrative specialist and went to school to become a nurse and returned to us and is now practicing as a nurse with the nursing division of the health department. She is in the maternal child program and she primarily works with the lead, children with the lead program.
Very good. Thank you, Liliana, for your service to our county. We appreciate it, and we hope you are here for many, many more years to come. Item 4, parliamentary procedure review. I asked that this be put on the agenda to give some direction as to how we're going to conduct meetings. And give a little refresher course on parliamentary procedure. As I stated earlier, we're going to do a roll call for the benefit of those that are not here. In the past, we've just always known who's here because we can look around the room and everybody knows everybody. But by today, with the audio and video that's ongoing, they need to be informed. Okay. I'm going to refer to items on the agenda by their numbers. For example, I will, item number, I'm going to make something up. Item number 5 is declaration of the administrative office. I will say item number 5, I'm going to turn it over to Melissa and or one of the directors at her discretion to do the introduction of the topic. And they'll give us a little explanation what they're trying to get across. Once that takes place, then I will wait for a board member to make a motion to approve or to put the item on the table so that it can be seconded, and then we can have a conversation, discuss it, ask questions of staff, ask questions of each other, and then eventually take action. I'm doing that for 2 reasons. One, so that we don't have a long conversation on something that's not ever going to get a motion and put on the table, and why waste our time on something that we're not going to take action on. And then 2, to encourage communication between staff and some board members outside of the meeting, ahead of the meeting, to prepare them for the topic that is kind of under their jurisdiction. For example, if it's an item that deals with with an ordinance, we're going to approve an ordinance. Ms. Carmen is the secretary, and she would be the one of the contacts that you could reach out to say, hey, this is what we're trying to explain, and would you put the motion on the table when we're together as a board? So that's the other reason is so that there is some communication between staff and board members in preparation for the board meeting. So I will ask for, or I'll wait for somebody to make a motion. And then keep in mind, if you make a motion on a topic, that's your topic now. It's your motion. So you are expected to, when a vote takes place, you're expected to vote in favor of it. If you don't, if you put a motion on the table, and then you hear information, and you hear somebody else's thoughts on the matter, and you change your mind, if you're the motion person, what you would do is you would withdraw your motion. If you don't withdraw your motion, you're expected to support your motion. I will look to have every motion seconded by someone. And that just means that the person that seconded it just means that oh, it's a good idea. Let's at least talk about this issue and see what the other board members have to say. The person that seconds it can vote either way. That's just, hey, I like the idea. Let's talk about it. All the other board members can vote as their conscience tells them to vote. Am I clear on that? Does everybody understand?
Yeah, I just have a question. Are we going to do that for the whole consent agenda as well, or is this just
Well, the
for?
consent agenda will be one item.
We'll consider
vote.
one, okay, we're not going, okay, all the different ones.
Correct,
That's- Okay,
correct.
all right, cool.
When we conduct the vote, the person that made the motion votes first. The person that seconded the motion votes second.
Drama.
Then you can do any order that you want.
If Darlene wants.
Correct. With the chairperson voting last.
I love it.
Can we practice that? But not with me. Like, can someone else practice?
This is going to be a work in progress. We're not going
Out of
to.
order.
Don't worry.
I move to censor Melissa.
Can I move to practice this?
I second.
It's not on the agenda.
Can I?
Check back next month.
We've kind of been doing that.
Correct,
Yeah.
correct.
Yeah,
We just haven't done the order thing.
yeah.
For example, on almost every monthly meeting, or on every monthly meeting, we have approval of minutes and the consent agenda. Generally speaking, approval of minutes is going to be the jurisdiction of this board secretary. While staff produces the minutes, it's actually the board secretary's minutes once they are put on the table. So in preparation for the meeting, the board secretary should glance over it and make sure that it's all good. And I'm encouraging that for the future. And then likewise, for the consent agenda, and the consent agenda, the majority of that is financial. Contract renewals, financial reports, et cetera. So the board treasurer, Dr. Ansler, I'm going to ask that you head that up.
Why is she sitting back there? Come on, join the party.
And then if there's other topics that are on the agenda and staff is wondering, well, who do I take this to in advance to have a communication? Well, look to the 4 standing committees and contact somebody on that committee for their input and their encouragement to put the motion on the table. That's all I got. Anybody else have thoughts or comments?
I'm moving to adjourn. No. Just kidding. Take it back.
I actually appreciate it because I'm the type of person that always wants to know what the role is supposed to be or what the expectation is. Thank you for putting that together.
Okay, the next item of business is item 5, which is approval of minutes, and I received information that the minutes for November's meeting are ongoing in preparation, and so we do not have them for us tonight. We will approve them in February's meeting, along with January's minutes.
I should have been informed that. No, I'm just kidding.
Well, I was gonna make a motion, I'm like, I'm not making a motion, there's nothing on there about the meeting.
Joe, I don't think I'm the board treasurer, am I? And I just don't know.
Yes.
Sure
Yes,
are.
you were elected board treasurer in the,
Abstention.
no, you were present. You accepted it.
Okay. I thought I was the chair of the finance committee.
You will be
That
as a
too.
result of being the treasurer.
Those two go together.
That's the award of being treasurer.
That's the award. That's the award of being treasurer.
The cherry on top.
Item number 6, Department and Division updates. I will turn it over to Administrator Adamson.
Okay,
Again.
I'll just give you a quick update on ARPA. So tonight we do have the renovation modification resolution in the packet. So there should be 2 more resolutions coming forward, and that should really be, will fulfill our plan, right? So the next 2 that are coming are the MAP work group initiatives. So those are our community health projects that we're mirroring after what the county did, making community grants. Along with that, they'll come at the same time, is a resolution for additional services from Bronner Group and Neighborly. Bronner is going to be, they are the consultant for the county who is responsible for providing the county feedback on ARPA projects to make sure that they meet the ARPA conditions and eligibility. So they are going to be an integral part of this process of reviewing. We're going to review the grants, bring them forward. They will ultimately have to check the boxes that it meets the eligibility criteria before we bring a resolution forward individually for each of those projects. But we have to pay them. That wasn't in the original bid. So we are going to have to pay for their hours, as well as Neighborly is an online platform where community members can apply for the grants and then they can ask for reimbursement and do their reporting through there. So we have to pay for that. Does anybody have any questions on?
Thank you. Next will be Director Noem.
Just a couple quick things. We are working, the directors are all working on a rabies training for all staff. It's a tabletop that we're going to do in February. Last year, we all got together and we did a similar tabletop exercise for foodborne illness outbreak investigation. So this year, we're going to do rabies, which is obviously cross-divisional to all the divisions. So we're excited to be doing that. And then I just want to let you know that we have, did get our training for our new laboratory equipment. That was a 3-day training provided by the manufacturer staff. And so right now we're in the practice phase. And then we're in the process of getting our quality control and our SOPs in place. Then the next step will be to do analysis of an unknown, you know what I mean, to verify our accuracy. And then we'll be completing our accreditation, which will involve an IEPA inspection of our laboratory. So we're trying to move that forward and hopefully wrap it up here as soon as possible. That's all I have.
Any questions?
I do. And I don't know if it would be with your department or animal control, but I would really be interested in rabies training from a knowledge standpoint. Is that something that I would benefit from an animal care person? Because I've never had it. Do you do one for your staff?
Yes. We could also do one for that meeting we're talking about having for all the rescues. We could do a mini version.
Yeah, that would be great. And then maybe get rabies vaccines.
Well, that's part of that. That was going to be part of my conversation at that meeting.
Okay.
So I was encouraging
Cool.
that.
All right, great, thank you.
Anybody else? Thank you. Director Karas.
First, I'd like to introduce, we're excited to have Linda Buck as our new Assistant Director of Clinical Services in the Nursing Division.
Welcome.
Your name again, I'm sorry?
It's Linda Buck,
Linda Buck, thank you.
like pass the buck.
Got it, I got it.
And we're doing a partnership with Youth and Family Services tomorrow evening to provide heart age screenings. That's a new partnership that we're excited to be doing. Our respiratory report is up on our website, so please, I encourage everybody to take a look at that. We are at moderate level for all respiratory infections and in the roll-up of that as well. It's starting to come down after we had kind of had a peak after the holidays. Patty and myself, my division, as well as our CIC is in DC this week, going to a national foodborne conference. So we're excited about what they can bring back for us to help us improve. We have finished our Huntley High School STEC outbreak report that is posted on our website as well. I encourage you all to read that. And the staff we heard this morning when they arrived, they got a kudos from the Minnesota State Health Department for that report. They read it and were very complimentary of the work we did and the thoroughness of that report. So that's a big deal because Minnesota is known for their foodborne knowledge and investigations of outbreaks. So that was nice for the staff to hear, as well as IDPH is present at this conference as well, presenting the El Sombrero outbreak that we were involved with and identified a national food outbreak with that one. So getting some recognition at a national level is making the staff, I think, feel pretty good about themselves, and they should. And then also, just want to update you. I know you might be hearing this. The state is updating their reporting system. It used to be called INED. It's going to be IDSS, Illinois Disease Surveillance Reporting System. And they were supposed to roll that out in February. I think I gave an update back in the spring about that. They're pushing it to March, where they're going to roll out the TB and STD diseases first, and then later in the summer, they're going to roll out the rest of the reportable infectious diseases. That's all I have.
Question, go ahead.
Would it be inappropriate for Ms. Buck to tell us a little bit about herself? Just so we know, Jenna,
Knowing Ms. Buck, yeah.
Wow. These two lovely ladies know me, I don't like to talk.
Which is kind of sort of why I asked, because I know you're Dr. Chris.
Yeah, thanks, Sarah. So my name is Linda Buck, and I'm excited to be here and start out on this new journey. This is week 3 for me, day 1, week 3. My background has been mostly in emergency room and trauma for the last 35 plus years. Most recently, I was the clinical operations manager at Advocate Lutheran General Hospital in the surgical services department. We did between 80 and 100 surgical cases a day. We were a level 1 trauma center, so we were very, very busy. But it was all good. We always try to do what's the right thing and what's the best for our patients and the outcomes. And I feel like, I myself personally am looking for a higher purpose to serve. I've been in the hospital setting for that entire time, and it's always the nurse and the physician, or the nurse and the staff. Where this way I feel this is an opportunity for me now to bring back to the community in which we serve, and which I've served in trauma and ER. And I think, I had my eyes woken up during COVID, that there's a lot of knowledge deficit out there with John Q. Public. Just from simple things such as hand washing or covering your mouth when you cough. So, hopefully this team has been very welcoming and warming. They're all very knowledgeable, and I'm excited to work with all of them to make a difference for our county.
Thank you.
Wow.
No slouch.
That was on the spot, too?
Go ahead.
Fantastic self-introduction. That was very good. Question about the kudos we received from the Minnesota Department of Public Health. How did that come out? That was at a conference, or was this spontaneous that they just?
Our staff is at a conference in Washington, D.C. this week. They left Sunday. And one of our staff was approached by somebody from the Minnesota State Health Department.
So cool.
Said that they read our report and it was fabulous.
Love it. When you need a little light reading, and you just, that's fantastic.
When you read it, get back to us on that later.
I will.
Dr. Anson.
I had a question regarding the Huntley outbreak. So this was an individual in the food preparation line who had a diarrheal illness with E. coli. Is that correct?
Well, she was asymptomatic, but when we can require food handlers to test, even if they're not symptomatic. And she came back positive with the E. coli stec.
So my question actually was going to be, how do we prevent this from happening in the future? People got very, very sick from this. Is there a way that we can prevent something like this from happening?
Well, I think with the fact that, there can be asymptomatic people, that, it wasn't a purposeful thing. So I think it's just what the school did. It really was if you read the report, it happened the way it's supposed to happen. A physician in Northwestern ED identified that there's something going on here, and he called us right away. So that was perfect. We didn't wait for the test results to come in. He reported it before we even had a test result. So what his suspect diagnosis was. So we were able to initiate investigation right away, get out to the school. The school cooperated with everything we asked. If you read the report, it kind of evolved into a huge investigation, especially for environmental health, as far as multiple exposures in this high school and outside the high school. So I think these things are going to happen. It's just mitigating it and stopping it as quickly as possible. It's unfortunate that there were some very sick kids. However, the numbers for this outbreak were pretty low. And I think it's just they initiated things. It was and I should probably leave this to Patty, it was a well-run kitchen.
Right, so I would follow up exactly what Susan was just saying, is that this is a kitchen that has a culture of hand washing, has oversight, has trained personnel. And I think really what we learned from this is even in a kitchen that is very well run, in the wrong circumstances, or when things happen, particularly when people are under stress or extremely busy, or whatever that is, that problems can still occur. So as part of our follow-up with the investigation with the high school staff, food service director, et cetera, we have talked about that and, things to put in place, to prevent it. So what we do in environmental health is just to continue to drive that message home of hand washing, hand washing, hand washing. It can never be enough. And the other thing is exclusion of, ill employees. But it's particularly difficult when you have asymptomatic individuals that feel fairly well, you know what I mean? And then they continue to work. So it's just something we continue to work on and continue to, to educate about as we're in the food facilities every single day.
But I think what is important too is once it's identified, and this is, Patty's doing a lot of education. Once it's identified, CD is, complementing that by doing more education and trying to put prevention measures in place. Educating people to stay home until, they're better, things like that. So it just, when it does happen, we have to intervene quickly. And it just worked out the way it should with the physician calling and not waiting for test results to come back.
So are asymptomatic E. coli outbreaks common? Is it common to have some asymptomatic? I mean, would it be worth having pre-testing, like yearly TB and all crap that you have to go to in hospitals?
It's not a common thing to do.
So
It's typically just driven by, illness and, you rely on people to report when they're ill, and unless Patty said, you start feeling better, you go back to work. And you're still, could potentially be shedding at a certain level.
So was this person asymptomatic all the time, or were they symptomatic, got better, and returned to work?
This individual reported no illness at all. Now, could there have been an illness, several weeks ago? We don't know. But it's what they reported, and we have to,
It's only information we have.
Right. We go with what they report to us.
Can you remind us where to find the report?
When you go to our website under the health department, you should see data and reports in the left menu.
Got it.
And
Okay,
then it should be under communicable disease, and then the tab with the outbreak.
thank you.
Do other physicians know, if this physician kind of called and reported it before, and we thought that was we saw the impact of that, do other physicians know that if that were to happen again, that not to wait for the results, to just kind of get ahead of the game so that, we hope that this doesn't happen again, but if it does, that we act on it pretty promptly like we did in this case?
Yeah, I mean, we followed up to report that this is what happened. And it is in the code that any infectious disease, even if a physician suspects it, they're supposed to report it.
Anybody else? Thank you. Good job for the employees that were involved, both departments, and good job for the boards. Thank you. Director Howell?
Okay, so I have just a number of things for you. One, we've been spending some of our, I hate to say this out loud, downtime working on training. You know, we did bring a lot of staff in over the last year. Everyone but our newest ACO has started the NACA 1 training, and then 2 of our staff have done the NACA 2 training. And then with our last bit of ALDF funds, that was the Animal Legal Defense, we used to send 2 of our officers to advanced cruelty training, and they got certification with the Animal Control Academy, which is part of University of Missouri. So that was good. And then we have our shelter internal kennel operations manager going to shelter management training next month. Next month? No, March, sorry. So that'll be really good because she'll be able to get certified in any types of the cleaning or disinfectants, as well as protocols that we might want her to be focusing on in the next year. Sorry, I'm distracted.
Sorry, I'm sorry. I've got a zillion pockets.
I just watched her check 8
Oh, no one, Frank, call her right now.
That was me.
So we do have our 2 cat clinics set up for the spring. We have a cat clinic on April 10th and a cat clinic on May 8th. And that will be with Dr. Peterson, who we just brought on in November. So she's going to be kind of handling the cat clinics, and then Dr. Kenny will be doing the dog/cat clinics if we have any of those. So once I get those clinics set up, I'll let you know of those. There was a little topic that came up earlier, and I thought, well, I'll just bring it up so everybody's on the same page. Livestock, farm animals, barns, all you have to have is food, right? You have to have wholesome food. It has to be clean food, no bugs. You have to have access to fresh water. A lot of times in that really cold weather that we had, it gets frozen, but you have to be going out a couple times a day to be breaking the ice, making sure it's fresh and they can get to it. And the last thing is you have to have a windbreak. A windbreak can be a set of trees. A windbreak could be a wall, a wooden wall. It could be a barn. There's a variety of windbreaks, but Department of Agriculture only requires you to have what they determine as a windbreak. Yes, there are times where there are animals that are out there and it's very, very cold, below 0 wind chill, but those are the requirements by law. So if we go to a farm, we go to someone's backyard farm, then what we're really looking for is, are you giving them enough food and water that they can stay hydrated and they can stay the proper temperature, right? They're going to be eating a lot more to get their temperature where it needs to be, and then you have to stay hydrated to help that process happen. So I just wanted to make sure if you ever get any phone calls, if we have any more severe weather, that you understand what those requirements are. And then the last thing was just that we finished up with ALDF in December, and we did get a number of equipment. I might talk a little bit more about that next month because they are recording some trainings for us that we'll be able to have going forward. So we had the training last November, but of course we had a lot of turnover. And I said, is there some way you can get us some training that we can use ongoing? And so they're going to be recording some trainings for us in their next process. And that is my list.
Any questions or? Thank you. Manager Dietz.
Just a couple things. We're kicking off the new year with the new budget, started December 1st. Fiscal year 23 budget won't be final until sometime around mid-March or so. The auditors, outside auditors will be in and they'll be finishing up their year-end entries. So, and that's all.
Questions? Director Marin, I'm sorry.
I know. That's all right. No, thank you. As Director Karas had mentioned, our communications information coordinator is also in Washington, D.C., and he was very excited about going until he found out where it was, and I discovered he had never flown on a plane before.
Yeah.
So I did talk to him today. Flight was fine, he's all good and enjoying it immensely, so good for him.
It's a lot warmer there.
Yes, yes. Staff will be meeting with NAMI of McHenry County, starting with our nursing division tomorrow. Animal Control will have a session on the 30th, and Environmental and Administration will have one in February. These sessions are for employees to talk about what they went through during COVID, afterwards, anxiety, how they're feeling. This is about wellness. Some control mechanisms, help mechanisms to help them get through a day if they're feeling anxious. So we're very excited to start this program in partnership with NAMI. They've been wonderful, and we'll see how the first session goes. We are currently reviewing the results of the succession plan survey from the staff, and the directors are putting together mission critical positions as we speak. We are trying to just kind of get maybe 10. We will go from there and then start interviews and focus groups and start planning from there on workforce development and other things. So we're very excited. ARPA, we're working with facilities on putting together an RFP for the Crystal Lake facility. As Melissa had mentioned, for that ARPA project, it's about a $2.4 million project. Bronner Group came back to us and stated we needed a justification letter. So that is in a draft form that we'll be giving to them very shortly. And moving on with that project, we're very excited. I've worked with Director Karas and Director Howell on what we want to do on both sides of the building, so hopefully that will help a lot. And that's all I have.
Any questions? The board? Dr. Amsler?
Are they projecting another outbreak of COVID-19, or this is just an ongoing low-level issue?
This is the ARPA funding that came because of COVID-19 and how we can actually, if we have another pandemic, how are we going to be ready for that and what are we going to do? Part of this project is a drive-through vaccination clinics that we can start having over there by using Animal Control, their garage, which we will have a drive-through done. So that scored pretty high with Bronner. So what can we do if something like this happens again, and how are we preparing ourselves? This is, safety for the staff, 6 feet apart, any kind of barriers that we can get, ensure that people are not roaming the hallways, and all of that type of thing. So this is all part of the project. We're even going to look at doors, having sliding glass doors so no one's touching and opening.
So it's not that anybody's predicting that this is in the offing. It's just that we want to be ready in case something else comes up.
Exactly.
Thank you. Thank you. Next item is item 7, consent agenda. Dr. Amsler, I'm going to look towards you.
Okay.
First of all, let me begin with this. Does anybody want any item removed from the consent agenda? Okay, seeing none, I'll turn it over to you, Dr. Amsler.
Then I move to accept the consent agenda.
Second?
Any discussion from the board? Here and seeing none, we will move to a vote. The motion was made by Dr. Amsler, seconded by Ms. Gaffney. And this will be a roll call vote because it involves finances.
Okay. Dr. Amsler?
Yes.
Ms. Gaffney?
Yes.
Ms. Ortiz?
Yes.
Dr. McGuire?
Yes.
Ms. Clark?
Yes.
Ms. Borowski?
Yes.
Ms. Carmen?
Yes.
Dr. Katz?
Yes.
Mr. Markison?
Yes.
Ms. Eltob?
Yes.
Mr. Clark?
Yes.
And that's how it's done.
Majority voted in favor and the motion passes.
Yeah, right? Thank you.
Item number 8 is program highlights.
Okay, so I am really going to turn this over to Susan, but we have a staff member who was an intern who worked on this project, and her name is Sally Zuzuli. Did I say that right? Yep. So she is here to present her project, right, for tonight, and I don't know if Susan would like anything else to add to introduce the topic?
She actually became an employee of ours and then was working
as on her
project. So she was able to do, the school allowed her to do the project where she was employed. So she created this syphilis risk assessment. She is working in our STD program and has done a tremendous amount of work on our website. So I again encourage you to look at our website on our STD page. That is all Sally's work there, and she did a great job. And then her risk assessment, we wanted to give her the opportunity to present that here because it is a lot of great work and good information. Hey, Sally. Okay.
So do you want me to change the slides for you, or would you like to do it yourself?
I can do it.
Okay. I think you just have to aim it. Well, we're going to find out where you have to aim it. It might be at the computer.
I saw something go across the bottom.
I can do it. I can advance them just with
Next,
move forward.
and.
Okay.
I'll just give
Okay,
this to
sure
you.
thing.
Alrighty, so thank you for the introduction. So we'll be discussing syphilis. So syphilis is a sexually transmitted infection, STI, or sexually transmitted disease, STD, and it's caused by a bacterium called Treponema pallidum, and it is treated with different antibiotics depending on the stage of the infection. And while it is completely preventable, treatable, and curable, syphilis can lead to long-term complications if not adequately treated. Next slide. There are 4 main stages. So the first stage is primary, and that is where a single or multiple sores are located where the infection enters the body. These typically last 3 to 6 weeks, and they'll go away on their own. So even if it goes away without treatment, the infection remains, and it will progress to the next stage.
Excuse me, I'm sorry to interrupt. Could you speak just a little bit louder?
Yes, thank you. And these can be easy to miss. The next stage is secondary stage, and common symptoms can include fatigue, hair loss, headache, fever, swollen lymph nodes, and more. And this is why syphilis is known as the great imitator, because it can mimic a lot of other diseases. A telltale sign of this stage is a rash on the hands and soles and feet, on the palms of the soles of hands and feet. And again, these symptoms can go away on their own, even without treatment. But again, this will continue to progress to the next stage, which is latent stage. And this is broken up into 2 subcategories. So early latent, and this is when the infection has occurred within the past 12 months, and late latent, which is when the infection has occurred over 12 months ago. And latent stage is when there are no visible symptoms of the disease, and without treatment, syphilis can remain in the body for years. Finally, we have tertiary stage, and this stage rarely occurs in the US now, but when it does, it can cause internal organ damage and death. It typically happens 10 to 30 years later, and can impact the heart, blood vessels, brain, and nervous system. Next, we'll talk about neurosyphilis, ocular syphilis, and otosyphilis. So these can occur at any stage and cause damage to the brain, eyes, and ears. Signs and symptoms can include severe headache, muscle weakness, mental status changes, ear pain, deafness, blindness, and eye pain. And these require prompt identification and prompt treatment. Next, we'll discuss congenital syphilis. And this occurs when a pregnant person that is infected with syphilis passes the infection to their unborn baby. So babies born with congenital syphilis, they may have no symptoms, or they can experience a rash on the hands and feet. They can also have deafness, teeth and bone deformities, saddle nose, stillbirth, miscarriage, death shortly after birth. So pregnant women should be screened 2 to 3 times during their pregnancy, at the first prenatal visit, at 28 weeks, and then at delivery, depending on the risk factors. Lack of early and routine screening, such as women with no or delayed prenatal care, is a major barrier to detecting and treating syphilis in pregnancy. And congenital syphilis is a rising public health problem.
What is saddle nose, just out of curiosity?
It's when the nose is born with deformities.
Oh, okay.
Yeah.
Thank you.
Looks like a saddle.
Yeah.
I thought you owned farm animals.
Never heard the term. Saddle.
Next
Saddle
we'll
is something else.
Next, we'll discuss treatment. So the current first-line treatment is called benzathine penicillin G, and it's also known as Vicellin. So it's given as an intramuscular injection once for those earlier stages, or once a week for 3 weeks for those later stages. Another treatment choice is an oral pill called doxycycline. It's taken twice a day for either 14 days for their earlier stages or 28 days for those later stages. Pregnant women cannot be given doxycycline due to the negative impacts to the fetus, so instead they should only be given Vicellin. And because treatment varies depending on what stage the infection is in, it's critical for providers to perform a thorough sexual health assessment and physical examination to determine the correct stage and treat appropriately. So we'll go over some national epidemiology stats. So first, there were 156,000 cases of syphilis in the US in 2021, and it had an incidence rate of 40.8 cases per 100,000 people. And when looking at congenital syphilis in 2021, the incidence rate was 77.9 per 100,000 live births, and this represents an almost 220% increase from 2017. So that's only a 4-year difference. And then you can see in the graph, the increase in congenital syphilis follows a steady increase in the primary and secondary syphilis cases among females aged 15 to 44 years old. We'll discuss some risk factors. So while syphilis is everywhere, geographic, racial, and ethnic disparities are very evident. So nationally, people at higher risk of being infected with syphilis include racial minority groups like American Indian and Alaskan Native, Black and African American, Native Hawaiian and Pacific Islanders, multiracial groups, Hispanic and Latino people, when compared to their white and Asian counterparts. And of the US syphilis cases, the majority are made up of men who have sex with men, or MSM, compared to men who have sex with women, MSW, women, and men who have sex with unknown partners, or MSU. And even though rates of syphilis among women are lower, they have increased significantly in recent years.
Did I advance too soon? Or are we on track? Sorry.
Oh, sorry, one more. Advance.
This one?
Yes.
Sorry, can you go back one slide?
So this is looking at congenital syphilis rates, and you can see that the trends are also applicable to pregnant women and congenital syphilis when looking at racial and ethnic minorities.
From the national overview, is there a plot map that shows where in the United States? Is it specific or generally across the United States?
The CDC does have a national overview broken up by states, and you can see that it has increased significantly, pretty overall throughout the states.
Thank you.
In the past 10 years.
Yes.
One more, yeah. Thank you. So looking more specifically at a county level, the MCDH Reportable Conditions Report of 2022, and this was last updated January 3rd, it describes that the county had 250.6 cases of all reportable STIs per 100,000 residents, and that there were 33 total cases of syphilis in 2022. So that would be an annual rate of 10.7 cases per 100,000 people. And according to the 2022 McHenry County Community Health Assessment, syphilis in McHenry County has shown a rapid increase in the reported cases from 5 to 32 cases, and those are from the years 2013 to 2020. So this represents a 500% increase in syphilis cases in McHenry County. And in 2021, the total cases reported is at 38, and in 2022, the total cases reported is at 33. So it continues to have that upward trend.
I hate to kill you, ask, this is so new to me, so I'm sorry about it.
Yeah.
Do they do contact tracing then?
We do surveillance for syphilis cases, yes.
And I obviously don't know the person or persons involved, but were any of the cases related? Are they all individual single cases that rose that? No.
Depending on, so how syphilis is tracked, there's a screening test and a confirmatory test. So to be counted as an official syphilis case, you need to have that confirmatory test done for the state to count it. And so some of those partner services, we are able to contact them and provide treatment for them, but not necessarily all of them will get that follow-up testing. So some cases are linked and are tracked, but other cases, they won't be counted just because they don't have the full testing done.
Thank you.
I'm happy to look this up on the website for the needs assessment, but just offhand, do you happen to know the age breakdown for this?
So we do have more specific trends regarding age breakdown. The highest age groups that we see for the incidence rate of syphilis are age 20 to 29-year-olds.
Okay.
The other age groups are suppressed due to data confidentiality, but 20 to 29-year-olds are the highest age groups.
And again, sorry, how many of these are pregnancy related? Do you know?
So these are just syphilis cases in total. For congenital syphilis, that data is suppressed as well because they are under 10 right now. And for the past few years they have been. So these are only looking at syphilis cases other than that. And obtaining accurate and current stats is a barrier that we experience, and that is expected to improve with our new electronic surveillance system that Susan was talking about, because syphilis will be added to that new system. And so this will definitely improve in getting accurate and timely syphilis reports. And okay, back one second, please. Thank you. So why is syphilis important to our community? So syphilis is an STI that, while preventable and treatable, it can progress to very serious health consequences. It disproportionately impacts minority groups, such as people of color and Hispanic population, young adults, pregnant women, and gay and bisexual men. So we have limited data regarding how it specifically impacts certain demographics in McHenry County, and that's just because many of our stats are just not trustworthy due to missing data points, specifically in regards to race and ethnicity in McHenry County. So we can look to our nationwide data points to figure out, which populations we need to target. But ultimately, it's imperative to address this serious health inequity and collaboratively create initiatives to be able to handle syphilis outbreaks to mitigate health consequences. When looking at cross-cutting issues, syphilis is a multifactorial issue. So many factors impact the success of McHenry County in managing syphilis and promoting health equity. The first-line treatment for syphilis is Vicillin, and that's under a national shortage expected to last until at least fall of 2024. So this is a major factor impacting the success of treatment of syphilis. The CDC and Illinois Department of Public Health have issued a notification to providers to reserve the use of Vicillin to treat only pregnant populations infected with syphilis, and instead treat other populations with that doxycycline instead. So this is concerning for several reasons. So first is issues such as medication compliance may decrease, potentially leading to treatment failures. Also, providers may struggle to obtain Vicillin for treatment of pregnant women, possibly leading to delays in care and an increase in congenital syphilis. We'll also talk about comorbidities. So STIs, HIV transmission, and syphilis are greatly linked. A person has 2 to 5 times more risk of acquiring HIV if exposed to it when syphilis infection is present. So not only does infection increase the risk of transmission to one another, but it can lead to increased stigma and barriers to receiving adequate care. And the COVID-19 pandemic also led to greater distrust of public health professionals and local health departments. And that was particularly exacerbated in more rural areas like McHenry County. So this could lead to decreased routine screenings and the public not wanting to work with us as closely on surveillance efforts. And there are numerous ethical considerations regarding syphilis. So first thing I want to address is the U.S. Public Health Service, USPHS, Tuskegee syphilis study that took place from 1932 to 1972. So it enrolled 600 Black men, 399 of those with syphilis and 201 without syphilis. Informed consent was not obtained, and participants were being told that they were being treated for bad blood in exchange for free hot meals and medical services. And when in 1943 penicillin became widely available as a first-line treatment, participants were not offered treatment despite knowingly being infected with syphilis. So the study continued to analyze individuals to determine the impacts that untreated syphilis can have on a human body. So it demonstrates the historic racism intertwined with the U.S. medical system and the massive distrust developed by marginalized groups in regard to the U.S. government, public health, and medical institutions. Yes.
Sure, a question in my mind there. Are you infectious the entire time you're in the latent period?
Good question. So it's typically most infectious in primary stage. You're still infectious until early latent stage. So usually within the first 12 months, you can be infectious.
So these gentlemen who were enrolled or like forcibly put into a study without knowledge, and then went through that into the latent stage, were they potentially infecting their families and everything throughout the entire period?
Potentially, and usually after that, year period, you may be asymptomatic, so you may not know what's going on, you may not know you have anything, but you can develop long-term implications like heart problems, brain problems, nervous systems, you can go blind, you can have deafness, and they still weren't being treated for that. But yes, you can definitely still be infectious in those early stages especially.
How, I don't know if I have the right word, but how hardy is it outside the body, the virus? Once it's
like when
dry, or I'm not sure, because I'm
fomites or
yeah.
Right. So it's typically transmitted through sexual activity and sexual contact. It can also be transmitted blood to blood, but typically if it's not spread through those means, it doesn't survive.
So it's not like, when you said ocular, it's not like someone touches something and then touches their eye and gets infected.
Correct.
Okay.
Yes, it would have to be through direct sexual.
Okay. Sounds good. Thank you.
Overcoming the stigma and discrimination around syphilis is also essential. So syphilis can impact anyone, yet it disproportionately impacts marginalized communities at higher rates. So factors like incarceration, intravenous drug use, sex work, living in rural areas, and comorbidities, those can all make accessing care more difficult. So public health has an ethical obligation to provide education and access to syphilis prevention and treatment. Syphilis impacts populations that have numerous intersecting factors, and it is essential that financial burdens and other social determinants of health not be a barrier for people to receive syphilis care and management. Patients must also be informed that they have the right to confidentiality when it comes to STI testing. So it's important to obtain informed consent whenever you're doing any cares performed, but also make patients aware that syphilis is an infection that is reportable to the state of Illinois. So that means while their information is confidential, if an individual tests positive for syphilis, their demographic and positive lab information will be sent to the state and local health departments for disease follow-up and surveillance. Youth aged 12 to 17-year-olds also have the right to consent and confidentiality for STI testing and treatment in Illinois. So it is crucial to educate youth about their rights as they are higher risk populations for STIs in general. It is also important to demonstrate awareness and sensitivity with this group. And based on McHenry County's demographics, cultural and ethical considerations, and risk assessments, 3 essential domains have been identified. So first is early detection and screening for high-risk populations. So due to the nature of syphilis, it is crucial to enact more screening and testing operations for those higher risk groups. This not only means increasing access to health centers that test for syphilis, but also to increase the education of syphilis to community members. Next is improving treatment success. So due to the shortage of Bicillin nationwide, it is imperative that providers follow CDC and IDPH guidelines to reserve the use of Bicillin for treatment of pregnant populations and use their best medical judgment on how to treat their individual patients. Also, it's essential for providers to perform a thorough physical and sexual health assessment on patients at risk of syphilis and comprehensive testing. So that means doing both the screening and the confirmatory test for appropriate staging and treatment. 3 is fostering collaborative management. Syphilis is an interdisciplinary morbidity with many complex factors impacting community health. So building partnerships between local and state health departments and local providers in McHenry County is crucial. So this will help to foster increased education about sexual health management, inform about new STI guidelines, and take down stigma surrounding STIs. And the McHenry County Department of Health STI program is committed to partnering with community, health, and government stakeholders to help increase STI education, resources, testing, accessibility, and more to support health equity. So these are some of our partners. So we offer free services once a month at PADS Homeless Shelter in McHenry, as well as Community Resource Day at Willow Creek Church in Crystal Lake. Open Door Health Center of Illinois is a health clinic located in Elgin and Aurora, and they specialize in HIV, treatment, prevention, and case management, and more. And so we are collaborating with them to host an STI and HIV testing event this Valentine's Day at Wolf Park. We also partner with MCC to provide young adults with free testing and resources at certain events. And we frequently collaborate with the Illinois Department of Public Health regarding training, resources, supplies, and more. So ultimately, syphilis is a multifaceted infection that is on significant rise. There are key populations at higher risk. There are many ethical and cultural considerations to take in mind, and it's important for us to engage with internal and external stakeholders to ultimately increase our knowledge and empowerment of individuals.
Is the blood test, is it a SNAP test or is it done laboratory in-house or has to be sent out?
So it'll be a blood draw through the vein. It just depends on different health organizations if they're able to test that. They'll be sent to a laboratory.
They're looking for the bacteria in the bloodstream?
Yeah, so there are 2 different types of screening tests actually test for the body's reactions to the antibodies. So many different things can set off the screening test. Pregnancy can set off the screening test, different medications or different conditions. So that's why it's really important to do that thorough sexual health assessment and also do the confirmatory testing so you have both pieces.
Is there follow-up with the client or patient if after doxycycline is prescribed, like they do with the tube, because that's a nasty drug, and I can see people like not taking it.
Right, and that's why we have those concerns regarding medication compliance, because people might not be as enthused about finishing a 14-day supply of doxycycline rather than getting 1 shot of the Bicillin, or potentially taking the doxycycline for 28 days if it's in those latent stages. So we definitely do follow up with patients and make sure that they are, doing okay regarding that medication. But that is something that we have concerns about for sure.
I was on it for a line preventative. It was awful.
What is it? Why does, I mean, I give it to the cats, that they don't like it, but what is the issue with people?
I was puking my guts out.
Really?
It was like rifampin. Remember when we were at rifampin? Just puking my guts out.
Oh, wow.
There's a lot of
Really?
It has really bad esophagitis too, and then people have been swallowing. It can be hard to follow.
You just need to toughen up,
That's right.
Joe, do you use CombiPen for the animals at your place?
Yes.
And that's the same drug?
Correct. That was going to be my question. What explanation are you hearing for why there's such a shortage in the penicillin type family of drugs?
Right. From what I know is that there's only one manufacturer of it, and I'm not sure if there's supply shortages, worker shortages, but there aren't any other options right now for other supply to get the Bicillin. So we're kind of at the hands of the manufacturer.
We're seeing a lot of shortages on what you would think are old, typical common drugs, actually, kind of across the board for all of those reasons, actually.
We should just raise the price $5 and then they tell us they can't, then we.
Who knows?
There's a shortage of dextrose, it's sugar and water. It's like, my question was, being a bacteria, is the doxycycline consistently effective, or are we running into bacteria, or pardon me, antibiotic resistant forms of it now?
Right. From what I know, we haven't been seeing antibiotic resistance, but it is a newer shortage that's been happening. So providers are, throwing out the doxy a lot more routine right now versus what they have been in the past. So it could definitely develop in the future, but as far as what I know right now, we haven't been seeing that.
So in preparation for that, I think you said this before, but they do confirmatory testing after completion of the antibiotic cycle also, or is that a plan?
Yes, so we do recommend follow-up testing at 6 months and then 12 months.
Okay, cool.
Yes, to see that medication success.
Okay, thank you.
Thank you, great job.
Any other questions? Item 9 on the agenda, new and unfinished business, committee list. I present the list of committees for board members to be assigned to.
What Darlene can find me.
Would you like a motion, Mr. Chairman?
Yeah. I just want to, there was a miscommunication on my part when I submitted this for printing. We are looking at the 4 standing committees: the Finance Committee, Personnel Committee, Regulation, Ordinance, Promotion Planning Committee, and the Hearing Committee. The Retail Food Advisory Committee and the Environmental Health Advisory Committee are just that. Our advisory committees are going to be special committees. That should not have been presented tonight. Those committees will be appointed when an issue comes up that needs to go in front of them. They're not, by our bylaws, a standing committee. So I will recognize Mr. Markinson in regards to the committee.
Sure.
Assignments.
Mr. Chairman, would you like me in my motion to name all the people to the committees, or just recognize the slate that you have presented?
The slate.
Okay. Mr. Chairman, I'll make a motion to recommend to approve the 2024 Board of Health Committees, the slate as presented, the 4 standing committees of Finance, Personnel, Regulation, Ordinance, Promotion, and Planning, and Hearing.
Second.
Second. Any questions or comments from board members? Everybody satisfied? Looks good? Okay. Motion was made by Mr. Markinson, seconded by Ms. Gaffney. We'll do a voice vote. All those in favor signify by aye.
Aye.
Those opposed say nay. The ayes have it. Motion carries. Any board members have board issues that they wish to discuss?
Thank you.
Yes.
I have recently been a part of several meetings that have discussed the tax referendum that will be on the March ballot for McHenry County residents. And since we have the Honorable McHenry County board member Pam Altoff here, I was wondering if you could speak a little bit about that, just to educate us on what that tax referendum entails.
And I'm going to start with reminding everybody that obviously governmental entities cannot provide any financial resources to a referendum. So this is a factual, informational presentation. So what occurred is when we were initiating our budget, the Mental Health Board came and presented their needs and said it was a huge ask, it was $2.5 million, but they too noted the extreme demand increasing from COVID, from a lot of other issues. So obviously, and basically also McHenry County was not competitive from a salary perspective because many of the people that we are trying to get in to provide those services, were going elsewhere because they could earn significantly more money. Conversations were had. Winnebago County did this several years ago, and it was suggested by some that we would switch from a property tax base to a sales tax base, which would mean that we would no longer allocate, the board would no longer allocate X amount of dollars from our levy, from the property tax. We would use our sales tax revenue and increase it by $0.25 cent. And that's what you're going to see on the ballot March 19th unless you early vote now, start right away in February. And the question you can go in, I think the most important part I want to share with you is you can vote and go in and ask only for a ballot for this referendum. You don't have to vote for anything else. Typically primaries are low voter turnout, but if we get this measure passed in March, it can take effect July 2024, which means that there's a possibility that we, the county, could not only reimburse our property taxpayers, but we could get that money from the sales tax going right away. It will raise, we have an RTA tax, and from those figures, we anticipate that the revenue that you would raise for the mental health board would be between $12 and $14 million first year. It would not tax, please tell people, it does not tax food, it does not tax medicine. Those are exempt from this $0.25 increase. So it is, even though people talk about it as a regressive tax, the food and the medicine are off the table. So the hit is not nearly as bad. In addition, obviously you have people who come and work in McHenry County or who drive through McHenry County, and they will also be subject to this tax, which is really good because you're getting a larger population. So we're encouraging everybody to be better educated. There are frequently asked questions on not only the county board site, but on the mental health board site. There is a group of individual activists who are trying to get the message out and encourage people to go to the polls. And again, if they don't want to vote in the primary, they can just get a ballot for this one simple issue. And we think it's extraordinarily responsible. And it will actually, in the first year, give the mental health board almost $2 million more than what the county has typically been levying for them over the past several years. And they have agreed. And the idea is that some of those funds will be put in a reserve fund, just in the event something happens, we'll have access to kind of a reserve fund. But we really believe that it's in the best interest for both the mental health needs of this community, of McHenry County, as well as for people who pay property taxes to keep the property tax bill lower. Be happy to answer any questions. But again, there's a very active group of county board members as well as mental health providers, staff, as well as people who serve on the board who are trying to educate the general public and tell them how important it is that they get out and vote for this referendum. And so I think it says mental health, yes. I think that's the tagline you'll see.
Go ahead.
What's their annual budget right now? 11.5? Or?
I can tell you what we levied for them was $11 million, between $10 and $11 million. And they typically keep a reserve of some funds. I think it's usually $1 million, $1.5 million. And then they allocate all the rest of the funds for providers.
Okay. I was trying to think, I think ours is around 8, something like that, right?
Our budget?
That's it. Yeah, the health department.
Yeah, I mean, it fluctuates.
Yeah, I was just trying to compare in my head. Okay.
Yeah, they have a larger budget, but they do a lot of community grants out, a
Right.
lot of their money flows through and out.
And then they asked for $2.5 million.
If they could provide all the services that were on tap that they were being asked to fund, it would require another $2.5 million in overall funding.
Thank you.
And again, we're trying to reduce wait times. I mean, many people are waiting 6 to 8 weeks to see someone to provide services. That's ridiculous in my estimation.
Yeah.
So we're trying to not only get more people, but reduce wait times and provide additional assistance.
Anybody else?
Thank you very much for the opportunity.
Thank you for the information.
Yeah, thank
Very
you.
good information.
I just gave you the information. The
Thank
presenter
you,
was
Dr.
sitting
Katz,
across
for
the
bringing that
table
up.
from me. Yeah.
If anyone is interested in joining this group who is working on advocacy, I'm sorry, advocacy.
No, you're advocacy.
That group can advocate, I can educate, they can advocate. You are more than welcome to share your information with me and I will pass it off. They're meeting once a week for the next 6 weeks, I believe, Thursday mornings at 8 a.m. at the Community Foundation in McHenry County.
And it can be
In Crystal Lake.
In Crystal Lake. And it could be as simple as agreeing to take one of the wonderful posters you can print right from your own printer and put it in your bathrooms and tell people exactly what the question is, and that it's not, although it's an increase in a sales tax, it could result in a lowering of property tax, which is really the big thing. And it provides additional monies for our mental health board, which I think is desperately needed under our current circumstances everywhere.
You can join those meetings virtually as well.
Yes. Which many people do.
You have something else?
Yeah, not so exciting, but just so people are aware, tomorrow and Wednesday, there's going to, the defenders are doing some seminars on how to reduce your energy costs and how to help, at the same time, using more sustainable practices and reducing your costs too through all the federal and state grants. Tomorrow, the one's in Spanish, and then on Wednesday, it is in English. They're on Zoom. And you can just sign up through the Defenders website. So.
Thanks.
That's it. That's all I got.
Next item is item 11, information and communications. We've got two under this category. The first one is from Animal Control, kind of a follow-up to some of the adoptions that took place over the last year and time. I would like to offer a compliment to Animal Control, to whomever does your social media, does a very good job.
We'll let her know that.
And it's a very good reflection on your department. Anybody else have any on the Animal Control? The next one is for the Vaccine for Children's program. Dr. Tomaso and staff met with the Department of Public Health and did a review on the program and received a very good report. No violations. Everything was in a positive manner, and another good job by those involved. Thank you. You have in front of you or in your board packet the appendix. That is for your reading. Anybody have any questions on any items in the appendix? There is a need to go into executive session under item 13. I will entertain a motion to go into executive session.
I'd like to make a motion to move to the executive session.
I'll second.
I'm sorry, who's the second? Juliana? And the purpose of us going into executive session is to do a performance evaluation and to review information pertaining to auditors, investigation and report. So the exemptions for going into executive session are exemption number 1 and exemption number 29. We have a motion was made by Ms. Gaffney, seconded by Ms. Borowski. All those in favor of the motion say aye.
Aye.
Opposed say nay. The ayes have it. We are in executive session.
What time did you say?
The time will be, we will start the second at 7:40.
8:47.
7:47. 7:47.
Okay, all right, thank you.
Not yet. Only if somebody requests.
We were sending a lot of animals out. We were sending.
No, thank you.
Mary Ellen, that's a good-looking rooster.
I posted them, you're gonna get a lot of activity